Diabetes is a metabolic disorder that disrupts the absorption and utilization of glucose or sugar. As that glucose and sugar builds up in the body, it can affect certain things in the patient. It affects the eyes, it affects the kidneys, and in the foot it affects the nerves, and that causes neuropathy. Neuropathy is caused in diabetics again, but because of an accumulation of sugar. The sugar goes into the nerves and it affects the nerves in an adverse way, and it causes significant numbness and burning and tingling. The burning and tingling can cause severe pain, but the numbness is the thing that causes a real problem when it comes to diabetic foot ulcers. Neuropathy not only causes a lack of sensation, but it can also cause other types of problems, such as what we call autonomic neuropathy. That is how it affects the sweat glands and the moisture of the skin, and also something called motor neuropathy. That's how it affects your muscles. And when the muscles are affected, we can get certain things like hammer toes and bunions and structural abnormalities. And then you have that with the autonomic neuropathy, meaning the skin isn't moisturized, it's not as healthy, and then we don't feel the pressure that's caused because of the peripheral neuropathy, and that leads to ulcer formation and breakdown of ulcerations of the foot. So when the diabetic gets a callus on their foot, they do not necessarily feel the pressure from the callus. A non-diabetic will feel the callus and have pain from the callus. But the problem is the diabetic patient who has neuropathy doesn't feel the callus as well. They develop increased pressure because they don't know to get the pressure off of it. And then that callus starts to break down. It turns maybe dark, meaning getting some dried blood within it. That can cause bacterial infection, and then it breaks down and forms an ulceration. Sometimes those ulcerations, if not treated well, can go into very bad things. That can cause osteomyelitis, such as a bone infection, and then that can cause certain terrible things like gangrene and things like this. There's three main things I tell a diabetic patient to do as far as their feet. Number one is control the blood sugar. That's the most important thing, not only for the feet to help prevent neuropathy, but also for your body in general. It helps prevent eye problems, retinopathy, kidney problems, nephropathy. Again, it helps prevent the possible peripheral vascular disease that we can see with it. So control of the sugar is the most important thing. And also controlling the sugar just helps things to heal better and helps the body to heal better. So control of the sugar is the number one most important thing. Number two thing to do to prevent problems being a diabetic, check your feet every day. Check them every day, check the bottoms. And you can do that by holding your foot over a mirror, and then you can look at the bottom of your feet, or if you have like a garment mirror, you could sit on a chair and hold your foot up on a garment mirror and look at the bottom of the feet, or have a loved one do it for you. Look for anything strange, any callus or anything that looks dark. And if you notice something, don't put it off. Call your podiatrist right away. Because if we catch things early, things can be treated very easily. Just get pressure off of it. The problem can go away very easily. It's when it's ignored by the diabetic or not noticed by the diabetic is when we get problems. So that's why it's important to inspect your feet every day. So if you have a problem, you know to get it checked out the next day. The third thing to do being a diabetic is protect your feet every day. We talked about controlling the blood sugar, check your feet every day, and protect your feet every day. Do not walk barefoot, even around the house. Wear indoor shoes that protect your feet so you don't step on anything such as a piece of glass or a toothpick or a sewing needle that could be in your carpet from years ago that you don't even remember dropping. I've taken all those out of people's feet, and I don't want that to happen to you. So make sure you protect your feet daily. Also in diabetic patients, we can see bad things like peripheral vascular disease. What happens in diabetics, the excess sugar can also increase the effects of atherosclerosis or thickening of the arteries. So one thing I always tell my diabetic patients is you have to keep your sugar under control, your blood glucose under control, because that helps prevent some of the atherosclerosis. And also, definitely do not smoke ever. Smoking can increase atherosclerosis, and that can cause severe peripheral vascular disease. And then diabetes can cause the same thing, and you put them both together and we can get some severe vascular problems. And if we develop an ulceration with the severe vascular problems, we are not going to be able to heal that problem. So finally, the main things to do being a diabetic: see your PCP so that you can keep your blood sugar under the best control you can. Do not smoke, and if you are a smoking diabetic, stop smoking because you will develop problems. Lastly, check your feet and protect your feet every day. And if you have any problems, call your podiatrist or call us here at Salem Wound Care Center.